Hello, sir. My name is Dina. I'm a nurse practitioner. I'm going to be doing your physical exam today.
Okay.
Can you tell me your full name?
My full name is Antonio Mendoza.
What do you prefer to be called?
Tony.
Tony.
Yeah.
Okay, Tony. Can you tell me your date of birth?
It's November 20th, 1990.
Okay. And what brought you in today?
I came in because I'm having just a bit of lingering tightness at the top of my lungs here with a bit of a lingering cough. I did have COVID a couple times, once in 2021 and in the summertime, and then a few months, or actually a year later. I did have my rounds of vaccines and everything, but I'm just concerned that the lingering cough and the tightness is sticking around. Also, I've noticed that I have sort of an irregular heartbeat once in a while. Mm-hmm. Just feels like a bit rapid, and then like it skips a couple times. So not entirely sure what that's about, but just concerned about it.
Okay. Well, it's a good reason to come in so we can get you checked out. So in terms of we'll start with the cough first. Does there anything bring it on? Or how does it usually occur for you?
Usually when I do some sort of a extraneous activity, so any sort of like jogging or heavy work, I do see that the result is that after my heartbeat kind of raises and everything, I get warmed up and everything. Afterwards, I have that sort of lingering tightness, so it's kind of difficult to take a full deep breath. Mm-hmm. And back when after I had COVID a couple times, I did wake up with sort of tightness, and it was kind of hard to breathe then in the mornings. Okay. But usually just extraneous activity.
So you say it feels tight on the upper part of your chest. Do you feel it anywhere else when you're coughing? It's tightness?
Nowhere else, just kind of right up here.
Okay, all right. So it doesn't radiate anywhere, the tightness, it's just right here in the front of the chest?
Correct.
Okay. And when you have a coughing spell, how long does it usually last?
I would say it would last about an hour or so. In terms of, after activity, then the cough comes in, and then it lingers on for maybe an hour. It diminishes.
Okay. And do you ever cough up anything? Are you able to produce sputum? Or?
No.
Okay, so it's a dry cough.
Correct.
Do you ever get sore throat from that coughing, or is it just really just constricted to the...
Just constriction of sore throats.
Okay. And have you tried any treatments for the cough?
No, nothing. Or even over the counter or anything. Mm-hmm. Just because it only stays for a little bit, and I notice it's only after activities.
Okay. And does anything relieve it, the cough or the symptoms of the chest tightness?
I think just relaxing, deep breath. I do try to take deeper breaths so that I can kind of relax around it. But other than that, I haven't really tried anything anymore.
Okay. And how severe would you say that chest tightness feels to you, if you could characterize it?
If I could put it on a scale from 1 to 10, I would say maybe a 3 or 4. Mm-hmm. I do notice that if I continue activity, then it does get more aggravated. So as soon as I do feel the tightness, then I'm sort of just kind of relax, take it easy. But no more than maybe a 3 to 4 on a 1 to 10 scale.
Okay. And then anything else you want to say about the chest issues, the coughing and the...
No, nothing else that comes to mind.
And in terms of your racing heart rate, and then feeling like it's skipping a beat, can you just talk a little bit more about that? What are you noticing?
I guess I can sort of I notice it because it feels irregular, so it's something that just kind of I notice randomly throughout the day. So I just kind of goes back towards my chest, and it starts to get a bit faster, mm-hmm. And I think it's when it sort of skips 1 or 2 beats where I feel the feeling is sort of like an empty sort of feel. Mm-hmm. That's the best way that I could describe it. It's like there's kind of like a void or something there. So it speeds up and then maybe skips 1 or 2.
And does anything bring it on? Have you noticed sort of a precipitating event, or does it come on randomly?
That comes out randomly. Yeah, maybe once every couple of weeks. Mm-hmm. Yeah, not necessarily tied to exercise or anything like that.
Okay. And how long do those symptoms last usually?
It's really just kind of the one iteration of it.
Yeah.
And again, just maybe once every couple of weeks.
So it's a brief duration. It doesn't go on for minutes or hours. It's
correct. Yeah.
Any other symptoms associated with that? Do you feel any pain in your chest or in your arms, in your jaw, anything like that?
No other symptoms.
Okay. And so we already talked about what brought it on. When you notice it, do you do anything to try to relieve it, or does it dissipate so quickly you don't really have time?
Yeah, it just kind of dissipates on its own after I notice, and that's really why I'm here today, because I'm not sure if it's something I should. Maybe there's something I can do at home, but otherwise, it just kind of happens randomly.
So we're gonna go ahead and we'll do a physical exam shortly, but I'm gonna ask you some other questions about your medical history. So you said you had COVID,
Correct.
And can you tell me a little bit more about your medical history, including even childhood illnesses that you had?
I did have asthma up until maybe 10 years old or so. I did use an inhaler, which was prescribed. And I think I do suffer a lot from tonsillitis. When I get sick and I have a cough or a cold, I do tend to get pretty severe symptoms. So that does make me think that perhaps once I had COVID, there was a bit of maybe the symptoms were stronger. So, but other than that, no other severe illnesses, and nothing in my family that kind of runs the same sort of symptoms. Yeah, there are other symptoms and illnesses in the family, but nothing connected to this.
Any surgeries in the past?
Yes, I did tear my meniscus, and that was about a year ago where I had surgery.
Okay. And you've recovered since then?
I have, yes.
Okay. Are you up to date on your vaccinations and immunizations at this point?
Last year I did receive COVID and flu updates, but nothing since then.
Okay. And you mentioned your family. Actually, before I get to that, are you taking any medications currently?
No.
And are you allergic to anything as far as you know?
Not that I know of.
Okay. So, in your family history, parents, siblings, grandparents, is there any history of heart disease?
No heart disease.
Okay. Any high blood pressure?
Not that I know of.
Lung disease?
No.
Any medical issues that you can recall your extended family having?
Just some cases of cancer on both sides of the family, but nothing within my immediate family.
Okay. And how are your parents now? Are they alive and well?
They are,
okay.
Yes.
Okay. And do they have any chronic medical issues?
No, nothing chronic.
Okay. So the next set of questions I'm going to ask you is kind of personal information about sort of your living situation, occupation, and things like that. Just to get a sense of who you are. What do you do for work?
I work for a series of coffee shops.
Okay. You're a barista?
I'm a barista.
Fantastic. You're a very important person.
Thank you.
And what's your highest level of education?
I have a bachelor's degree.
Your living situation, and do you live with roommates, significant other?
I do live with one roommate.
Are you currently sexually active?
I am.
Okay. And are you using contraception?
I am, yes.
Okay. Any history of tobacco use?
Yes, when I was, over 5 years ago now, I was smoking more regularly, but not so much as that. Yeah.
Okay. Congratulations. Any recreational drug use in the past or currently?
Yes. Currently, recreational marijuana.
No. Okay. And any alcohol use?
I do drink, maybe 3 or 4 drinks per week.
Per week, okay. At one time or throughout the week?
Throughout the week.
Okay,
yeah.
All right. Any concerns about your safety and your living situation?
No.
And any history of depression or anxiety?
No.
Okay. Have you ever thought of hurting yourself?
No, that's what you said.
Okay. Okay. So I'm just gonna ask you a little bit more about sort of your general health history and then a little bit more about your cardiac health history and your respiratory health history. Have you noticed any fevers or night sweats recently?
No.
No. Any weight changes in the past 6 months?
No.
Okay. Have you noticed any easy bruising or bleeding?
No.
Okay. In terms of your cardiac, you mentioned that you were having a racing heart rate from time to time and feeling like you've skipped beats. Any other chest pain that you're aware of?
No pain.
No? Okay. Have you ever noticed any swelling in your legs?
No.
No. Okay. When you sleep, do you have to use pillows to kind of prop yourself up? Do you have trouble sleeping at night flat on your back?
Yes, I don't sleep flat on my back. I either sleep on my side or propped up.
Okay. Is that how many pillows would you use if you were kind of propping yourself up to sleep on your back?
2 at least.
2.
Yeah.
Okay. And in terms of your respiratory issues, have you ever had any wheezing?
Only during the bouts of COVID.
Okay.
And again, the sensation that I get when I have the constriction is similar to when I was wheezing, but now no audible wheezing.
Okay. And have you ever had any coughing with blood?
No, not with these symptoms.
Okay. All right. And besides the COVID pneumonia, have you ever had a bacterial pneumonia in the past?
No, not that I'm aware of.
Okay. And no history of tuberculosis?
No.
Okay. All right. I think we'll stop there in terms of the questions, because I really want to do a focused exam of your lungs and your chest and your heart. So I'm going to step out of the room, and you can go ahead and get changed, and I'm going to need you to remove your shirt, and we're going to go ahead and do a physical exam of your chest, thorax, lungs, and heart. I'm just evaluating and assessing, inspecting the patient's respiratory rate, the symmetry of the movement as he's breathing. I'm looking for any signs of trauma or lesions, and seeing none, I'm going to go ahead and assess for chest expansion. Okay, Tony, I'm going to go ahead and put my hands underneath your throat here, and I want you to take a deep breath in and exhale. And one more time. Okay. What I see is about a 2 to 3 centimeter movement in between when you inhale and exhale, which is normal. Okay. I'm going to go ahead and put my hands on your back, and what I'd like you to do is just keep repeating the number 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, thanks. You can stop. And then what I'd like to do is I'm going to just percuss, and you don't have to do anything now, just go ahead and breathe normally. No findings there. Then I'm going to try to find the level of your diaphragm in your diaphragmatic excursion. So what I'd like you to do is go ahead and go ahead and breathe out. So exhale as much as you can. Okay. And inhale. So I'm seeing a diaphragmatic excursion of about 3 centimeters for you, okay? Which is in normal range. I'm going to go ahead now and listen to your breath sounds. And you can just breathe normally. Take a nice deep breath. And this time I'm gonna listen again, but this time I want you to repeat the letter E until I ask you to stop. Okay?
Okay.
Go ahead.
E. 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 E.
Okay, thank you. Okay, now I'm going to listen again, and this time I'd like you to say 99, okay?
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, thank you. And this last one, I want you to whisper 1, 2, 3 as I listen, okay? Okay. Fantastic. Okay. So I'm going to come around to the front now. Have you turn around. And we're going to do your anterior chest.
Okay.
I'm inspecting the chest wall now. Again, looking for any lesions or bruising or obvious trauma, normal respiratory pattern, and work of breathing. Tony, I'm going to go ahead and sort of do the same thing that I did before. I'm going to have you say 99 again as I press my hands on your chest. Go ahead.
99. 99. 99. 99. 99. 99.
Okay. Thank you. And I'm going to go ahead and do some percussion here. And obviously feeling a little different note over the top of your heart, but otherwise have any significant findings. And I'm going to go ahead and have you take some deep breaths. So these should be deep and full, okay, but relatively normal rate and rhythm. All right, so the respiratory and exam's done, and we're going to go ahead and get started on the cardiac exam, okay?
Okay.
So what I'm going to need you to do is we're going to need you to lie down. Okay, Tony, I'm going to go ahead and assess your jugular venous pressure, and the way I'm going to do that is I'm going to look at the pulsation in your internal jugular vein. Which appears to be right there. Let me just double check that with the light. Okay, and I'm going to go ahead and measure card. And still not much. And you are right at 2 centimeters. Right in the normal range. Fantastic. Okay, go ahead and put these to the side. I'm going to go ahead and assess your carotid pulse. I'll go ahead and do your right side first. And the left side. I'm going to listen those same areas. Okay. Go ahead and assess your brachial pulse. impulse. Other side. And good cavity fill there too. On at it. Okay. Okay. So I'm gonna go ahead and I'm gonna try to locate your PMI, which is the area where the apex of your heart actually touches your chest wall. Actually, why don't you go ahead and sit forward and drop your feet down. I'm just going to have you lean forward a little bit. I just want to make sure I've got it. Right about here. I'll just take a look here. I'll go ahead and measure that area. About a centimeter. Okay. You can lean back now. And I'm going to just, not all the way back. I'm going to go ahead and just feel for any pulsations or thrills. So the first thing I'm going to do is go forward here a little bit. Squeeze. So I'm feeling really no impulses there. I'm going to go ahead and assess for thrills now. Okay. And no abnormal findings there. I'm going to go ahead and listen to your heart. Okay. Well, I heard no abnormal beats, and a strong S1 and S2. Didn't really find anything abnormal in your exam, but I would like to do an electrolyte panel, and maybe we can also get a chest x-ray to see if there's any residual issues from your COVID infection last year, okay?
Good.
All right.